Hey guys, welcome to our headaches webinar. This is Sarah Zastro, and I have brought in the expert today.
Hi
This
guys.
is Peggy Ivan, and she is a headaches expert, pain expert. And so what she does is craniosacral therapy along with a lot of other pain techniques. And we're going to talk about how to lower your chances of having headaches today. So take it away.
Hi guys. So I am a physical therapist and massage therapist, but also a headache sufferer. So I have had headaches for years.
Me too.
Yeah. Unfortunately, that's one of the things that I've gifted Sarah with. So they can be debilitating, they can be fatiguing, they can make you cranky, not to mention they're just painful, but also they affect your concentration. Sometimes they affect your vision or your hearing, and certainly make it just unpleasant at a very baseline, just unpleasant, up to a higher level headache that are just like, I can't function, I need to go in a dark room and lay down. So when I was a teenager, it was like menstrual stuff and just really bad 3-day headaches, menstrual things. When I got in college, it was more muscle tension, maybe some toxins, alcohol, caffeine. I'm not sure, like some of you may have had some of those things in college. So, and then as a young adult remodeling this house, it was toxins. It was varnish and paint and stain and just constant 9 months of refinishing and dust and things like that. And I remember one time having like a paint party and having my sister-in-law and some friends come over, and as soon as we opened those paint cans, it was about killing me. It was everything I could do to get through the day. I just wanted to get out of there because it hurt so bad, and I didn't understand at the time, until I was right in the middle of it, that it was just all those toxins, and it didn't take very much of an increase to put me over the threshold where I just had a debilitating headache. But life goes on, and you just kind of got to get through it. And then also just like sinus headaches, allergy headaches, more tension headaches, things like that. And then sometimes I get this really severe one-sided headache that kind of feels like someone's foot is in my eye, a boot to the eye, just a such bad right eye pain. And that is when my C2 is rotated just a little bit. And so now with the experience of having headaches, differentiating between types of pain and location of pain, and a better understanding as a PT, what is caused when there's a lot of different headaches and causes of headaches, which means a different treatment. If it's a different structure, then it has a different function and it's treated differently. So I'm going to go through some of that with you today. There is hopefully just a little bit of education will help you to differentiate between what type of headache you have and then what you can do about it to get back to your normal life. So there's kind of 3 types of headache. One is chemical, so hormones, allergies, too much caffeine, caffeine withdrawal, too much alcohol, wine, nitrates, things like that, allergy type things. Sometimes will just trigger a headache. There's these high headache trigger foods. So those are chemical things. And the best thing that you can do from those is avoid the things that trigger. So know what triggers your headaches and how to avoid it. Dehydration is another one. Being hungry, that's a big one. I get a headache about 2 in the afternoon and go, oh gosh, I skipped lunch today. That's why I have a headache. And unfortunately, it's kind of too late at that point. So for me, if I have a headache, a food headache, and then I eat, it might not fix the problem, but it always resets at night. And so then the next day I'm fine. So the good thing is it doesn't last too long, but prevention is key. So set a timer, make sure you schedule time for lunch. If you can't have time for lunch, eat a snack. That's a really big one. Go ahead.
One thing I noticed that my headaches were really triggered by a lot of blue light. So as great as it is to say avoid screens, that means I can't work, I can't talk on my phone, I can't do anything on social media, which is my entire business, right? And so not having screens is not realistic for me. Probably a lot of like you guys, if you have a job that requires you to be on the computer, then it's just not realistic. And so there are blue light filters you can use, all different sorts of things, glasses, and I just super simple turn the blue light filter on my phone and on my laptop, and my headaches went from probably 3 headache days a week down to 1. So that's
good.
Yeah, that made a big difference for me.
Yep. So some of the other, so those are kind of chemical imbalances, too much chemicals, not enough chemicals, blood sugar too high, too low, not hydrating, not eating, not sleeping, sugar, alcohol, caffeine, nitrates, things like that. So those are common causes of chemical type headaches. And then the next kind of headaches are structural. So typically, and we'll get into treatment after I teach you a little bit of anatomy, but typically chemical headaches need to be treated with chemicals, whether it's the food or the caffeine or lack thereof. But structural things are treated structurally. So that's my specialty. That's what I love to do. So if it's a structural thing, it means something is out of alignment, or something is too tight, or something is not allowing blood flow, or something is pinching a nerve where there's actually a change in the structure. And the good news is that we get to change it back and decrease your headaches. So there can be poor posture, like Sarah was talking, this forward head. We look down at our computer and then it's time to go. So we're here rather than here. So if I'm forward, turn sideways. I'm just going to show you. So Sarah's on her computer. So she's got a couple things here. She's got tension here. These muscles are working. And then when she looks up, she's got some compression here. Look down. So this opens it up. She's looking at her computer and somebody says, "Hey, Sarah." Then this pinches here. This pinches right here, which is where your vertebral arteries are that take blood to your brain. So if you didn't get enough blood to your brain, do you think it might cause a headache? So we're going to open that up. So sit up nice and tall. And see, this opens this up a little bit more here, and the muscles, her head is actually on top of her shoulders versus before it's a head. So gravity's pulling her head straight down, and the muscles have to keep it in a good position. Now her head is right on top of her spine, so it's like holding that 10-pound bowling ball on top of your hand rather than down here. So posture is a big one. Nice straight back, shoulders back, ears over your shoulders, shoulders over your hips, eyes straight ahead. So setting up a good workstation is also important. The glasses that you use, the screen height, things, all those things are really important. So if your screen is too low or you're kind of in a funky position, to try to get there. I actually ended up with TMJ one time because I had my computer on too low and I couldn't see it very well. So I was doing this here and then here rather than up here. As I do this, my jaw comes forward and I locked up my TMJ. So that also can cause a terrible headache. So posture is a big one. The other thing is just muscle tension, and those are cause tension headaches. So we can have tension headaches here in our frontalis and frontal muscles here. And those, sometimes that can be eye strain. We can have a temporal headache here where, oh, my temples, I'm just so tight here. We can have this occipital headache back here, in the back of your head, down into your neck, a cervical headache, and even down into your thoracic spine, and kind of thoracic headaches here again. And then, like I said, TMJ things also. So,
which is here, if you guys are familiar with that.
Temporomandibular joint is your jaw.
Yeah.
So those are really big ones. And then sometimes, believe it or not, all these bones in our head move just a little bit, not a lot, but they kind of open up a little bit and close a little bit, and open a little bit and close. And if one side's stuck and the other side is moving, or like in your jaw, if one side opens and not the other one, you're getting translation here, and so it's moving crooked and it's pinching on one side and opening on the other. The same thing can happen with your vertebrae. That vertebrae C2 here rotates a little bit, and then it's straining the muscles on this side and pinching the muscles on this side, and it causes that headache. Or if you get this pain behind your ear or to the top of your head, there's usually something out of alignment in your neck or your head. And this occipital headache too, that also can be pinching or just not gliding right, not moving right. So that's what I specialize in, is craniosacral therapy and working on loosening those restrictions up. Your fascia is everything, just that fascia layer over your whole body. And when that gets tight, especially in your head, it can tighten anywhere in your body, but specifically to headaches, I feel like my head's too tight. I feel like my head's jammed on my, pounded my head on my shoulders. And so just by opening up a little bit and releasing that, that can decrease those headaches as well. That a lot of times is around the ears, the temporal, up into this whole band here. And sometimes also if it feels like your hat's on too tight, that pressure all the way around, that can either be addressed with craniosacral or myofascial release. We'll get into that more in just a minute. So lastly, the third type of headaches are due to inflammation. So this can be allergies, it can be menstrual stuff, it can be weather changes. I'm not supposed to use my hands, sorry. So it's with weather changes, it might not be true inflammation, but the pressure changes as the weather changes, and that can affect our headaches too. So what do we do about it? So the first thing we can do, going back to the chemical headaches, are avoid the triggers. If caffeine, alcohol, nitrates, wine, cheese, any of the sausages, any of those high trigger foods cause headaches, then learn to avoid them. And you may need to use a food diary and keep good track of that, and that may help. Typically, if you're eating too much of something that it gives you a headache, sugar is a good one for me. When I get this dull, low-grade headache, really in the afternoon, I get sleepy, I know I've had too much sugar and I need to detox, sugar detox. So usually you can go without for about 3 days. It is pretty much difficult and torturous, but it's well worth it when you're done. There are easier ways to kind of cut down sugar, caffeine, alcohol. Those all kind of have the same type of low-grade headaches that make you not want to function. You just want to lay down and sleep. And getting rid of those substances really will take your headaches away. So that's a big one. As hard as it is, as tempting as those things are, you really want that 4 o'clock wine, or whatever. The chocolate's another trigger, unfortunately. So those are big ones to just avoid and to detox if you're using too much of those substances.
What about salt or spicy foods? Can that be headaches?
Yes, absolutely. Yes. So salt attracts water, so that causes inflammation. So that can do it. And it can mess with your blood pressure. Blood pressure headaches are a whole nother ball of wax. And if it truly is a blood pressure headache and your blood pressure is that high, you need to call your doctor. Do it. Just do it. Okay. Drinking water will help you hydrate, and Sarah is great with giving you the water tracker, 10 million reasons why you should drink your water, ways to make water more appetizing, and so use it. Drink your water. That will help tremendously.
Half your body weight in ounces per day. That's the golden standard.
That's the golden standard. If you can't quite get there, start with 4 8-ounce glasses, work to 8 8-ounce glasses. You can do it. I know you can do it. If you do it earlier in the day, you don't even have to pee at night. Well, not as much.
Probably.
Right. So if it's a hormonal headache, that's a little bit difficult to, like you can change your hormones, but if you are on hormone replacement or something like that, you can adjust those, have those dosages adjusted a little bit to kind of help with the headaches. But pain relievers, and I'm not prescribing pain relievers. Pharmacology is not my specialty. It is not in my scope of practice, but my history is that when I have hormonal headaches, I need to take some pain relievers to take care of that. So know that there are side effects, and you can talk to your doctor or your pharmacist about those. I'm not the person to talk to about those, but my history says pain relievers for me work for hormonal headaches. Get more sleep. That's a big one. And make sure you're eating regularly. So you need a little bit of protein, a little bit of carbs for energy, and you can have a little bit of sugar, put some jam on your toast, or excuse me, sugar in your coffee or whatever, you know, whatever you're used to, just not too much sugar. But make sure you're eating breakfast and lunch, even if it's just a little bit. And if you skip one or the other, please don't skip both, because then you'll get that 2 o'clock headache, and that's no fun. Again, we just want to sleep at that point. My head hurts so bad, I can't concentrate. Eat lunch, it'll help.
Eat lunch. You guys, there's a lot of trends right now, and whether it's keto dieting or
intermittent fasting.
Do not do those. Do not do those. Okay, we'll do a whole other webinar on that with the help of a registered dietitian, but do not do those. Okay,
so eat breakfast or lunch, and that will help the food headaches. And then stress can contribute to chemical headaches. Also, there's a whole bunch of hormones and the stress cascade, and those things can cause headaches as well. So Sarah has a ton of videos, great YouTube videos, great techniques. I can teach you some techniques as well, but stress management is really important to decreasing those headaches. So that's kind of the chemical headaches. Now the structural headaches are, like I said, we're going to fix those structurally. So the big thing is sit up straight, chest up, high beams on, okay? And then make sure that you change your positions frequently. So you're going to do just some shoulder circles, some stretches, even some reaches, some twists, a little bit of gentle circles, not too much, about 20 seconds every 20 minutes. And then every hour, get up out of your chair, move around, motion is lotion, add some music to it, bebop around a little bit, and then you can get back to work. It will help oxygenize you, get more oxygen to your brain. It will wake you up a little bit. It will put you in a good mood, and I guarantee you will be more productive than if you didn't take the 10 minutes in the first place. So that's a big one. Make sure that your desk is set up ergonomically correct. So I've got my computer on a few books, and so my screen is a little bit higher. It's at a much better level for me. I may need to use a separate keyboard so my hands aren't way up here, a separate screen. Just make it work for you. Make sure that your arms are at your side, and Sarah also does a great ergonomic assessment on working at home or in your office, either way, and so use those as well.
The checklist is on our website, so if you guys need that, go grab it. It's free. Everything's free.
Decrease eye strain, that's a big one, and Sarah touched on that with the blue screen filters, the eyeglasses, just turning on your blue light filter on your phone, your tablet, your screens. Those are good, helpful things. And then stretches. So just some easy stretches. I'm going to show you real quick, side to side. Make sure that when you're stretching side to side, you're not doing this, because I'm not really stretching. Your shoulder stays down, and I'm stretching here. So this is getting longer. Deep breath in, deep breath out. 3 times. You can say Father, Son, and Holy Ghost. You can say compassion, love, and joy. You can get rid, as you breathe, exhale on whatever, negativity. And then 3 breaths this way. Breathe out any of that anger. Breathe out that negativity. Breathe out that stress. Breathe in. Okay, we're going to turn our heads to the side. Breathe in joy. Breathe in hope. Breathe in peace. And then to the other side. This time you can breathe in love. And then breathe in happiness. And breathe in grace. That's a good one. Okay, and so I typically do my stretches for 3 breaths. On the exhale, I stretch a little further. Inhale, exhale, stretch a little further. Inhale, stretch a little further. So ear to your shoulder, and then turning each way. And then 2 more good ones are nose towards your armpit. So you're actually, it's like ear to your shoulder and then looking down for 3 breaths. And then ear to your shoulder and looking up for 3 breaths. This one's harder for me. I find my whole body moving. So just do it gently, and you don't, this shouldn't cause pain. You're just going within a comfortable range of motion and not causing any pain and just stretching there gently. And as you exhale, maybe stretching just a little bit more. So those are for your scalenes. And then also for your mid-back, you can round your arms forward. You can tuck your chin. And you can go side to side with these if you want to. And you can twist a little bit, arm across each way. So that'll get your mid-back and your neck. And then a real tight chin tuck, real nice and high, like if I was pulling up on Sarah's ponytail, then that will stretch your occiput down here. This is really double chin. I got lots of chins here as I do this one. So that's a really good one too. Okay, so a lot about stretching. Again, we've gone through a lot of stretches before. So same stretches, just using them to decrease tension in your neck, your upper traps, your scalenes. But I'm going to teach you some trigger points that you can use. So if you've got these sinus headaches or eye strain headaches, you can go right inside of your eyebrow, right here. I do it with my thumb, and there's a little notch there. It's kind of at the top where your eye or your nose and your eye meet. So when you do these are like acupuncture points, but we're using acupressure. So instead of needles, we're just using our fingers, and you want to go straight in. So you're just going to, so I use my thumbs and kind of go straight in, and I might take some deep breaths. And it's kind of tender. This is like a really tender point, but when it starts to ease up, or if you feel any throbbing or lightening or warmth or any changes, then you can let go of that one. And then this one is right above your pupils and your eyebrow. So that's a good one too. And I would go more in this way, but then you can't see my face. Where your nose meets your cheekbone, right here's another one. Again, straight in. Watch your fingernails. You might need to trim your nails for this. So that's a good one. And then along your cheekbone where it meets here, this is called your zygomatic arch. This is your zygoma. I love that word. So you're going to just push in here. So those are great ways to relieve your sinuses here. In the back of your head, I'm going to turn around, and there's a couple more that I do. Okay, we'll do it on Sarah. So these muscles come up, and they're like bands at the back of your head. There's the bone right here, and the muscles come up. And so it's the muscular portion where it attaches to, I'm going to hold Sarah's head right there. Muscle portion attaches to the bone. So I'm going to hold there, and then I'm going to go, so hold that. That's one. And then the second one is you're going to go one thumb width over and one thumb width down in the soft part. And there's a really good one. That, when you get those occipital headaches, those tension headaches in the back of your head, that feels great. Okay, and then two more, you come down to where your neck meets your shoulders. There's one there. And then 3 fingers out, there's one right in the middle of these muscles right here. So again, down here. And if I'm doing that on myself, then I'm just going to reach, I can reach around to my neck here. And so I'm just going down to where my neck meets my shoulder, and I'm pushing with my middle finger, or I can go out, or I can just do it with one at a time. And I'm kind of pushing straight down with my finger in the belly of my upper traps here. So those are good ones for this neck and this muscle tension here. So those are really good ones there. Another one is your third eye here and your crown chakra on top. I usually use both hands. So I put my thumb here. Sometimes it feels good just to press there. The top is right on top of your head. That feels like it just opens up your head, or you can do both of them at the same time. Oh, that feels so good. Okay, so those are good ways to kind of release the pressure in your head and do a little bit of a jumpstart craniosacral therapy. And then the other one is TMJ, and you can just use your hands flat and pull down on your face like a puppy. You can go back, up, forward, You can do circles. You can also, sometimes they just pull.
That's what I do a lot.
Yeah, it looks like you have a spoon in your stuck in your mouth. Your toothbrush. I know these are funny. It's like a filter on the on the pictures, except there's no filter. This is my real face. All right. Then the other one I do is the ear pull, and this is more of a myofascial release. And when I feel like just this tension is just right around my ears, or it's going up in a band, then I use this part of my finger. I bend it and I put it in my ear, and I pinch my ears, not real hard, but enough to get a grip. And then I kind of take my ears and pull back and out. So I'm going to go back and out. I guess I'm pulling this part of my finger is in my ear, like not in this way, but in here. Back and out. This immediately feels better. I feel this actually and across the bridge of my nose. Oh, that's weird. I do too. So this is a great one. You can let your eyes close. Ah, feels so good. All right. So that's an ear pull. The other things that sometimes we just instinctively do, we know how to heal ourselves, just like we rub a bruise, like, oh, it hurts, you know, suck on a paper cut, something like that, is a hair pull. And so we take our hair and we just pull it like we normally, maybe not, but just to just relieve that tension. Sometimes with the weather change pressures, there's a high pressure system, it's pushing in, and we just want to push out or pull out to take care of that, you know, those pressure changes. So that's an idea too. And then unwinding. And so as you're doing these, if you feel like moving, like you're doing an ear pull and you feel like moving, then you can just kind of go with that. So if I'm doing my ear pull and maybe it feels like my ears are pulling back, or maybe, I don't know, maybe it feels like it's going one way or the other, you can kind of just go with that and go, just pull this, however, whatever feels good, whatever you feel like doing, but just kind of go with that, unwinding just your neck. You can kind of go till you feel a stretch, and then you're just going to hold it, and as it releases, it looks so sleepy. Get all relaxed here. And you can feel that down into the middle of your back, wherever the tightness is, wherever your fascia is tight, you can catch that with the unwinding. So that's a great technique to use. So some craniosacral, some acupuncture points, some myofascial, some unwinding. Those are all great tips. Plus your stretching will help address the muscles, the fascia, and the blood vessels just by releasing the tension around the blood vessels. So those are all great structural techniques to decrease a structural headache. So the last thing we talked about was inflammation. And so, of course, you can take anti-inflammatories. Again, there's side effects to those. And so consult your physician, your pharmacist, knowing that there's side effects, but the anti-inflammatory medication typically reduces inflammation. But also, in addition to that, or instead of that, there's a lot of anti-inflammatory foods. And Sarah has given you an anti-inflammatory food list. And if did you do that already?
I'll send it out.
So you can get that, and there's lots of foods that are good. Berries are really good. The darker the food, typically the better. So raspberries, blueberries, spinach, kale, just all those dark foods. Nut oils are good. Chocolate is good unless it's a trigger. So if it's a trigger, then don't use it. A cold pack. So if I have a really bad headache, then sometimes the best thing I can do is take an ice pack and just wrap it around my head and go in a dark room and fall asleep. And by the time that I wake up, then that cold has decreased the inflammation. It's decreased inflammation in the back. Sometimes migraines are from too much blood to the head. So cold constricts those blood vessels and decreases the circulation, and that will help decrease the migraines. And then also just good, clean eating. So that's a whole bunch of different ways that you can address your headaches. If you have any questions, feel free to message Sarah or myself, and we can answer those questions. And if you need some myofascial release, some craniosacral therapy, good massage to release the muscle tension, then that would just be a wonderful thing to do after we can get together after the COVID isolation.
All right, guys, let us know if you have those questions. I hope you have a good day. I hope you learned something from our headaches webinar, and we will see you next time.
Bye.